If your doctor has recommended chemotherapy as part of your cancer treatment plan, there's a good chance that it will include one of the most commonly used and effective drugs in the arsenal against the disease. Doxorubicin is an anthracycline antibiotic, originally isolated from the bacterium. It is highly effective at killing cancer cells, but its use has been limited by its serious side effects. However, recent advances in drug delivery systems have overcome this problem, allowing doctors to use higher doses of doxorubicin more safely and effectively. In this video, we will talk about what these new advances are and how they could help you fight your cancer more effectively. We will also discuss some of the other benefits of doxorubicin and why it is such an important tool in the fight against cancer. So stay tuned. There is no doubt that chemotherapy is one of the most effective weapons we have in the fight against cancer. But with great power comes great responsibility. And that's because chemotherapy drugs, like doxorubicin, can cause some serious side effects. That's why doctors have to carefully weigh the risks and benefits of chemotherapy before recommending it to their patients. But new advances in drug delivery systems are changing all of that by allowing doctors to give higher doses of doxorubicin. Means that more people with cancer may be able to benefit from this life-saving drug without having to endure its harsh side effects. So let's take a closer look at what these new advances are and how they work. One of the main challenges in cancer treatment is getting enough of the chemotherapy drug to the tumor without causing damage to the patient's healthy cells. Doxorubicin is one of the most effective chemotherapy drugs available, but it is also one of the most toxic. It works by interfering with the ability of cancer cells to copy their DNA, which eventually leads to their death. But unfortunately, it also damages the patient's healthy cells, especially those that are rapidly dividing like hair follicles and bone marrow cells. This damage can cause serious side effects like hair loss, nausea, and a weakened immune system. But new advances in drug delivery systems are changing all of that by allowing doctors to give higher doses of while protecting the patient's healthy cells. One example of this is the use of liposomes are tiny spheres made of fat molecules that can be used to deliver drugs to cancer cells. When doxorubicin is encapsulated in a liposome, it is protected from being broken down by the body and can reach higher concentrations in the tumor without damaging the surrounding healthy tissue. Another advantage of using liposomes is that they can be designed to release the drug only when they reach the tumor. This means that healthy cells are spared from the toxic effects of Several clinical trials have shown that this approach is effective and safe. For example, a study published in the Journal of Clinical Oncology in 2018 that this liposomal formulation of doxorubicin was effective and safe for treating breast cancer that had spread to other parts of the body. The researchers concluded that this new way of delivering is a promising treatment option for women with metastatic breast cancer. Another advance is the use of antibody-drug conjugates. Antibody-drug conjugates are a type of targeted therapy that uses antibodies to deliver drugs to cancer cells. An antibody is a protein that is produced by the immune system to fight off invaders like bacteria and viruses. By attaching a drug to an antibody that targets cancer cells, doctors can deliver the drug directly to the tumor without harming the surrounding healthy tissue. This approach has several advantages. First, it allows for higher doses of the drug to be given, because it is only released where it is needed. Second, it reduces the side effects of the drug because healthy cells are not exposed to high levels of it. And third, it makes it easier to track the drug and see how well it is working. Several antibody-drug conjugates that contain doxorubicin are currently in development for the treatment of various types of cancer, including breast cancer, lung cancer, and leukemia. One example is trastuzumab-emtansine, which is a combination of the cancer drug trastuzumab targets HER2-positive cancers, which are cancers that have too many copies of the HER2 gene. HER2 is a protein that helps cancer cells grow and divide. And by blocking it, trastuzumab can slow or stop the growth of these cancers. The U.S. Food and Drug Administration approved trastuzumab in 2019 for the treatment of adults with unresectable or HER2 positive breast cancer who have received 2 or more prior anti-cancer regimens. This approval was based on the results of a clinical trial which showed that patients treated with trastuzumab-emtansine lived significantly longer than patients who received a standard chemotherapy regimen. These new advances in drug delivery systems are just the latest in a long line of improvements that have made doxorubicin one of the most widely used chemotherapy drugs. Doxorubicin was first isolated from the bacterium Streptomyces peucetus in 1961 and was approved for use in humans in 1975. Since then, it has been used to treat a wide variety of cancers, including acute lymphocytic leukemia, acute myeloid leukemia, breast cancer, lung cancer, ovarian cancer, and testicular cancer. Doxorubicin is often used in combination with other chemotherapy drugs to increase its effectiveness. It is also sometimes used along with radiation therapy to treat certain types of cancer. But doxorubicin is not a cure for cancer. It is simply a tool that doctors use to help control the disease and improve the quality of life for their patients. However, despite its effectiveness, the use of doxorubicin has been limited by its serious side effects. As mentioned earlier, it can cause damage to the patient's bone marrow, which leads to a decrease in the production of blood cells. This can make patients feel tired and weak and increases their risk of infection and bleeding. Doxorubicin can also cause damage to the heart muscle, which can lead to congestive heart failure. In addition, it can cause severe low blood pressure, a potentially fatal drop in blood pressure that occurs when the body is not getting enough blood flow. This can cause a number of other problems, including organ failure and shock. Despite these challenges, doxorubicin remains one of the most widely used chemotherapy drugs because it is so effective at killing cancer cells. New advances in drug delivery systems are making it possible to use higher doses of doxorubicin. These advances are improving the lives of cancer patients by giving them a better chance of survival and reducing the side effects of treatment. So if you or someone you know is facing cancer treatment, don't lose hope. With advancements in medicine, there is always hope for a brighter future. Now let's move on to another important aspect of doxorubicin, its mechanism of action. Doxorubicin is an anthracycline antibiotic, which means it is a type of chemotherapy drug that was originally derived from a natural source, in this case, a microorganism. It is thought to have been originally developed as an antibiotic, but its anti-cancer properties were soon realized, and it became one of the most widely used chemotherapy drugs. Doxorubicin works by interfering with the ability of cancer cells to copy their DNA. DNA is the genetic material that tells cells how to grow and divide. When cancer cells try to copy their DNA in order to divide, doxorubicin binds to the enzymes that are responsible for copying DNA. This prevents the enzymes from working properly, and as a result, the cancer cells die. Doxorubicin also works by generating free radicals. Free radicals are unstable molecules that can damage DNA and other important cellular components. By damaging the DNA of cancer cells, doxorubicin causes them to die. In addition to its anti-cancer properties, doxorubicin also has some other interesting properties. For example, it has been shown to have some anti-inflammatory effects. This means that it can help reduce inflammation in the body, which is a good thing, since inflammation is often associated with cancer. However, it is important to note that the anti-inflammatory effects of doxorubicin are not the reason it is used to treat cancer. Its primary use is to kill cancer cells by interfering with their ability to copy their DNA. Despite its effectiveness, one of the main problems with doxorubicin is that it can cause serious side effects. As mentioned earlier, it can cause damage to the patient's bone marrow, leading to a decrease in the production of blood cells. It can also cause damage to the heart muscle, leading to congestive heart failure. And it can also cause severe low blood pressure, which can be life-threatening. Because of these concerns, doctors have to carefully weigh the risks and benefits of doxorubicin before deciding whether to use it to treat a patient. Despite these limitations, doxorubicin remains one of the most widely used chemotherapy drugs because it is so effective at killing cancer cells. Thank you for watching. We hope you enjoyed learning about the new advances in chemotherapy for cancer treatment. If you have any questions or comments, please leave them below. We would love to hear from you. And if you haven't already, please subscribe for more videos like this. We release new videos every week, and we would love to have you as part of our community. Thanks again for watching, and we'll see you next time.